Welcome to Break the Needle. I'm your host, Adam Zivo, and I'm here to tackle Canada's problems with drugs, addiction, and crime. Today, we're joined by Dr. Laurie Regenstreif, a Hamilton based physician with 15 years of experience practicing addiction medicine. Laurie has been one of Canada's leading critics of so called Safer Supply, a government run program that distributes free recreational drugs, mostly opioids, to addicts under the assumption that this reduces overdoses and deaths. She's joined us today to raise awareness about a concerning phenomenon in Ontario: Safer Supply teleprescribing. It's a practice wherein doctors remotely prescribe dangerous drugs to unstable patients, which maximizes profits while endangering communities and compromising patient care. Welcome to the show, Lori.
Thanks, Adam.
Now, Lori, can you explain to us in simple terms what is so called safer supply?
Well, very simplistically, safer supply is the prescribing of uh, very strong opioid pills, which are then dispensed by a pharmacy, usually on a daily basis, sometimes a few days at a time. Those are dilaudid 8 milligrams almost exclusively. However, other people have defined other opioids similarly, but the equivalent is 8 milligrams. Dilaudid tablets, usually 30 to 40, are dispensed a day.
Just a quick
So
question. So,
that,
what
yeah.
exactly is dilaudid and how powerful
So
is this?
Dilaudid is hydromorphone. An 8 milligram Dilaudid tablet is, did the math several times over, 40 milligrams of morphine. So one tablet is the equivalent of 40 milligrams. And just for perspective, if I were to break my leg, even if I was given an opioid for pain, it would be 1 milligram of Dilaudid. I might have a few tablets to take home for the first couple of days of pain, and that would be it.
Okay, and
People
just a
who
quick
have
question.
cancer pain, yeah.
For me, as someone who doesn't use opioids, how many of these pills could cause an overdose if I were to take them, or anyone else watching this show who doesn't use opioids?
Well, a couple of pills could cause an overdose. I've had youth patients report that they or a companion has overdosed on 2 to 3 of them, who, if they're opioid naive. So if
And
you don't usually take opioids and you're not used to them.
and how many pills are, like, let's say, how many pills does a single safer supply patient get on average per day?
On average, I believe 20 to 30. I haven't, nobody's audited the system to find out what to get a bigger picture of this on a provincial level. But to the reports I get from patients who've received these in the past are 30 to 40 milligram, 30 to 40 tablets a day.
Okay, so we're giving out 30 to 40 tablets a day, every single day, to every single safer supply patient. And just two or three of these can cause an overdose in someone who doesn't use opioids. That's a lot. That's a lot of drugs that are going into our communities. So why have Canadian governments embraced this experiment?
Well, there was, especially after COVID, and there was a period of time where we had a significant rise up to 2023 in overdoses, and there was the appearance, it was the optics. So the appearance of doing something. There was a demand from non-scientist activists who weren't familiar enough with public health issues and the whole issue of societal safety, who were pressuring the government and vocally promoting this practice.
Okay, and is there any real evidence that safer supply actually saves lives?
Uh, Self reports. So qualitative self reports by a subgroup select people who've reported to these programs, which are obviously looking to validate themselves. So that's the evidence that we have. We don't have objective evidence that these tablets all by themselves, without a patient also being on a long acting opioid like methadone or Suboxone, that they do anything to protect people from overdosing.
Okay, so this program where we're giving out a very large number of opioids is predominantly justified by qualitative self reporting, which essentially means interviewing drug addicts and asking them if they like the program where they're getting a whole bunch of free drugs. That seems kind of iffy.
Yeah, you nailed it. Yeah, that's exactly that's the evidence. Yeah.
And,
We don't
presumably there would
consider
be,
that evidence-based medicine,
yeah.
but some
And
people
there are
do.
many harms that can come from this program, and we're going to explore those harms when we come back after the break in just a few minutes.